I'm Marta Waller. Welcome to Inside Plastic Surgery. Today we're going to talk to world-renowned plastic surgeon Dr. Richard W. Fleming about blepharoplasty, upper eyelid surgery. Hi, Dr. Fleming. How are you today?
Good. How are you?
I'm good, thanks. You know, everyone says, the eyes are the windows to the soul, and we don't want those windows to be closed. But this is really a delicate surgery. Tell me a little bit about what we should know about upper eyelid surgery.
We've talked about rhinoplasty many times, and we said it's surgery of millimeters, but it's even smaller millimeters with the upper eyelid. What we have to consider is what's the ideal, what's the norm, both in terms of function as well as appearance. The upper lids, they should be a little bit convex, inferior to the brow, below the brows, be a little bit rounded, and that should gradually move into the well-defined crease and the fold of the upper eyelids. So it should be full, it should not be hollow as we see with aging eyelids, and obviously they should function properly, because with aging you get relaxation of the lid, you can get excess skin, you get relaxation of the muscles, and you can actually impair vision, and that's well documented. So it's about form and function. Both have to be carefully considered when evaluating a patient for a blepharoplasty, which is eyelid surgery.
Well, we do see people whose eyelids have become so heavy, it's like they're working hard to keep their eyes open. And when they have had the surgery, you hear people say, "Oh, I don't feel as tired. I see better." So that's one of the functions.
And one of the considerations of the aging eyelid, as we look at the aging eyelid where it becomes more hollow, look at the youthful eyelid. Look at Rihanna. Look at Cameron Diaz. They have a nice fullness, a shape to them, a form. When you look at the older eyelid, it tends to be hollow. It's very gaunt. And that's because they've lost fat. There is extra skin. That extra skin, while it seems minuscule, when you're talking about the small, fine muscles of the eyelid, people can really experience eye fatigue, especially if they're working on computers, they have work or they enjoy reading, that type of thing. They can really get eyelid fatigue, and that's one of the goals of upper eyelid surgery, is to relieve that tired appearance as well as the tired feeling.
So talk a little bit about the surgery itself. You're not just removing skin. You want to promote a more youthful look. How do you do this?
Well, several things to consider. Number one, if the muscles have relaxed, and you see that where their eyelids actually hang over the pupil. They have that tired look. That's relaxation of the muscle. The muscle can be tightened and lifted. You look at older eyelids, they're more gaunt, they're hollow. So we can do liposculpture. We can take fat to contour the upper lid and fill it in so it's not so hollow. Next to the nose in the upper eyelid with aging, you can get a hernia of fat. So that's not there in the normal, youthful lid. So we're removing that. And last is removing the extra skin. And that can involve repositioning the upper eyelid crease, which can move with aging. So we can actually raise or lower the upper eyelid crease and then remove whatever is appropriate in terms of extra skin.
When someone is going to have this surgery and says, "Do you think it's time to have my eyelids done? It's time for the blepharoplasty." What are the top things and top questions that should be asked?
Things to consider are obviously lid and eye function. In other words, is there any problem with dry eyes? Is there any visual problems? Is there any what we call visual field defects? In other words, as I sit and look at you, I can see out here very clearly, but with a lot of extra skin of the upper eyelids, that really hinders your peripheral vision and really can impact your function in terms of vision. So all of those things are considered before doing the surgery.
Now, what are the risks of upper eyelid surgery? What should patients be on the lookout for?
I think most of the risks associated with upper lid surgery are surgeon error. because it's a very safe procedure in general, because you're not working typically within the eyelid, you're not adjacent to the eyeball, you're removing skin, you're adding fat, you're removing herniated or bulging fat. So it's a straightforward procedure. It's a matter of being judicious and conservative in terms of what you do. We all see the eyes that have been overdone, and they look gaunt.
When you go to have the surgery, how long does the procedure take, generally speaking?
Depends upon what you have to do, but in general, the procedure takes about an hour. And depending upon the individual, you can actually do many of the upper eyelid blepharoplasties under just local anesthesia. If a person is not a real anxious personality and so forth, you can achieve excellent anesthesia with minimal injection. So it's, in that respect, it's a easier procedure for the patient. They heal much quicker than they do with the lower eyelids, which can be more difficult to do. But recovery's week or 10 days at most. They in general heal very quickly.
So within about a week, you can be wearing makeup again and back out in the world.
Stitches that have to be removed, and many of them are absorbable when we're doing the upper eyelids, but stitches that have to be removed are usually removed about 6 or 7 days. And at that time, they can put on makeup and be presentable, and both in their personal and professional lives. What we frequently say is make sure about your surgeon's training, certification, but also very important regardless of what cosmetic procedure we're talking about. Look at before and after results. See if that surgeon's aesthetics, the results he achieves, are compatible with your desires.
I want to thank Dr. Richard W. Fleming, world-renowned plastic surgeon, for being here today and giving us all these wonderful answers. Thank you very much. And till the next time you join us on our chat with Dr. Fleming, I'm Marta Waller. We'll see you next time. Thanks for joining us.